Hello, everyone. Thank you for joining me in the next 30 minutes when we discuss yield improvement opportunities for the blood plasma space. My first section would be how to discuss which challenges the blood plasma space in the industry is facing, followed by which advances, which technologies would enable to improve the yield in those processes. Thirdly, I would talk about how to optimize the purity of the product. And the fourth point, I would like to discuss further options to utilize the maximum proteins that are available in plasma samples. The challenges the industry is facing are multiple. Basically, there is an increased demand in blood plasma products as a therapeutic. We have seen, especially in the immunoglobulin space, an underserving of patients, even in the Western Hemisphere. And the last years during crisis, when plasma donations dropped, and those two factors converging together put a certain pressure on the industry to optimize the processes and utilize plasma to its maximum. And how is this done? Basically, the industry needs solutions that are easy to use, ready to use, can be scaled into industrial scales, allow a product safety and the required quality for the product, and as a final end up with fulfilling all the requirements that are set by the authorities. And how do we support this with the innovation of our affinity solutions, as well as the high performance polish resins that we offer? So this is an overview of a simplified process to isolate a therapeutic protein from a plasma pool. And we suggest to early use affinity capture to capture the maximum of those valuable proteins before any process-related product loss could have occurred. So as a second step, we would suggest use affinity capture with our high-performance resins, which are basically off-the-shelf available for a multitude of targets that are relevant for as a plasma therapeutic. And then as a second step, we suggest to use high-performance polish resins that allow a very efficient and streamlined process to end up after having virus safety and filtration and formulation targeted and solved, to end up with a highly pure and cost-effective process and product. So this is an overview on how our affinity technology works. CaptureSelect ligands are basically derived from camelid IgG that is raised by immunization. After that, the IgG is analyzed, sequenced, recloned into yeast, and optimized for certain attributes like caustic stability, elution behavior, etc. And finally, we end up with a highly selective and highly specific ligand that allows to target a protein, which can be isolated through an affinity resin very efficiently. On this slide, we show an overview on the main performance attributes of the CaptureSelect FcXP resin, which is the target or the resin that enables to target plasma-derived IVIG. It allows to have a very streamlined and one-step purification of these valuable immunoglobulins, even from a very crude source. It is highly selective as the binding occurs through the CH3 domain, as displayed on the right-hand side in the schematic molecule of IgG. And with binding the CH3 domain, this allows to be very selective to target IgG and distinguish from other immunoglobulins as well. It allows to recognize all the immune classes, the immunoglobulin classes, equally, which means in the end you will have a product that contains all the 4 IgG subclasses that are present in plasma. The ligand is available on 2 different solid supports. One is POROS, which is a perfusion bead technology. And the other one is an agarose-based solid support, which is called CaptureSelect FcXP. And with this resin, and this will be the resin where we will focus on the next slides. This resin allows to have a slightly higher binding capacity as to the POROS version. However, if productivity is at the focus, the POROS resin selection can be even more beneficial. Both resins can be eluted at mild conditions, which is very compatible to immunoglobulins and other Fc fusion proteins, for example, as well. And it is a proven and scalable solution that has been used in industrial scale already. On this slide, I'm showing a comparison of a traditional cone fractionation-based purification process of IgG on the left-hand side, which has at the very beginning, after removal of the cryoprecipitate, and then after creating this cryopure plasma, has 3 ethanol precipitation steps, which have the necessity to have equilibration times, to have solid removed, the supernatant and further processed, and in the end, the precipitate 3 will be extracted and used for further processing. It is clarified and then subjected to further purification, like polish operations, various safety operations, formulation and fill finish. These labor-intensive and time-consuming process we suggest to change into a very early adsorption on an affinity resin, as displayed on the right-hand side in this process flow. After clarification of the cryopure plasma, we suggest to early adsorb IgG, use the flow-through for further processing of other proteins, and then subject the washed eluate of this affinity resin for further polish and then filtration and virus safety treatment before we will have a suitable and basically pure IVIG product. So in the end, we will be able to change the time-consuming process, the more costly process, and the more energy-intensive process, since we will not need intensive cooling in our process suggestion, into a more sustainable process as well. Now I'm going to show a couple of slides about affinity capture, how the resin performs over multiple cycles, how the purity looks like. So this is the protocol that we performed. Just very briefly, at the beginning, the column is equilibrated with phosphate buffered saline at pH 7.4. So in principle, any buffer that has near physiological salt conditions and very close to neutral pH is suitable. Then the cryopure plasma is loaded directly on the column. It is washed out. All the unbound proteins are washed out of the column before with an intermediate wash 2 with slightly elevated salt. The purity of the bound IgG is increased. Eluted is the material afterwards with a 0.02 molar acetic acid at pH 4. This is basically the product fraction, and then the column is stripped with the glycine, pH 2. It is, well, in this case, re-equilibrated and subjected to caustic treatment for sanitization every 5 cycles. For sanitization, 20 minutes residence time and 100 millimolar NaOH are used. On the right-hand side, you see the loading conditions. 7.3 gram per liters IgG from plasma is loaded. We see column dimensions, a volume of 5 milliliter lab scale column, residence time of 5 minutes, which is typically used for this kind of agarose-based resins. And we have a DBC found of 39, DBC10 found of 39.1 mg per mil, and we loaded 80% thereof in the current continuing study that I'm presenting. So this is the result of 100 cycles performed with the protocol that I just mentioned. We see here the IgG mass in the eluate is very constant over 100 cycles. This proves the solution delivers a very constant result over this high number of cycles. And we have an IgG yield that is in an average of 94.8% and stays very high over 100 cycles. So very important for IVIG products are the subclass distribution of immunoglobulins. And you see in this graph here the CPP or cryopure plasma subclass distribution at the bottom, and comparing these selected runs out of those 100 runs we performed shows and proves that there is no change of the subclass distribution over the entire resin life cycle. The resin was tested 100 cycles, but this is not the end of the resin life cycle. So the life cycle continues and the resin can be used further. We just stopped the study at this point in time. So what about the impurity clearance? You see here an evaluation of the 3 key impurities that are found in IVIG processes. And then these 3 impurities typically need to be removed further by ion exchange chromatography later in the process. So in this example, you see over those 100 cycles, IgA depletion on the left-hand top chart. IgA depletion stays high over 100 cycles, close to, in the high 90s, close to 100%. And so IgM depletion, we have a similar picture, stays high, close to 100% over those 100 runs. So on the other side, you see factor 11 tested. Factor 11 is a pro-coagulative protein that needs to be removed in order to prevent patients from the unlikely event of thrombosis after being given these IgG products. And we see here over 100 cycles, near 100% removal of factor 11A. This proves that this affinity solution can deliver a high purity over the tested resin life cycle. On this slide, I would like to talk a bit about the purity of those different eluates that were taken in these 100 runs. And we see on the left-hand side a SDS page evaluation of those runs. Compared on the lane 2, the input material cryopure plasma with the full complexity of protein signals, and the following lanes 4, 6, 8, 10, 12, and 14, the lanes in black, we see the flow-through fractions, which contain the full complexity again of the protein signal present in plasma. And in red, displayed in red, in those lanes, we see the eluate purity. And what we see is there is a very intensive IgG band that appears, but there is no additional protein band found based on this method. On the right-hand side, we see the evaluation of those eluates based on size exclusion chromatography, which allows a judgment about not only other proteinaceous impurities, but also about aggregation behavior and how the situation with regard to aggregates is after this affinity capture. And what we see is there is widely monomeric IgG found in all those 100 runs. So how about ligand leaching? Ligand leaching is a critical factor or critical measurement when affinity resins are discussed. And with the CaptureSelect technology, we typically find very low amounts of leached ligand. In this study, we found an average of below 1 ppm of leached ligand, which is a very low leaching result of this non-toxic ligand. Secondly, I would like to mention that the FcXP eluates, the purified purified IgG eluates were tested with a newly developed activity assay that's called ACTIC-1Q, that was developed by our collaboration partner, which showed that selected eluates from those 100 runs showed a positive signal in this in vitro functionality assay. So this study basically proves the eluates are able to work and do the job those IgG molecules need to do in the patient as well. What about productivity? So what we see here is a productivity evaluation of the agarose CaptureSelect resin applied in the protocol that we discussed earlier. These 100 runs that we tested were performed with a CIP run every 5th run. It displayed in red here. This result proves that high productivity is maintained over 100 runs. Whenever there is a CIP performed, the productivity slightly drops because the protocol is elongated by the CIP incubation. After the CIP incubation, the following run shows higher productivity again. So what we see here is just a mixture of runs with and without CIP, proving that the productivity is very stable over a high number of runs. Concluding, we could show that affinity capture can be a viable option and can deliver a high number of cycles for the plasma protein space. It enables to purify IgG subclasses equally, which is a prerequisite for a IgG product. And it can withstand 100 millimolar NaOH as a CIP protocol. And it can remove and significantly remove the factor 11 impurity that needs to be removed for the safety of those products. Now I'd like to talk a bit about the further polishing of those eluates after the affinity adsorption. There might be the need for some additional polish, and I'll talk through a couple of slides in this study now. This is just a reminder of what we talked earlier. Now we are talking about polish resins, where we rely on the high performance resins coming from the POROS family, which deliver a high performance that is independent of the flow rate and offer high capacity and a wide salt tolerance. This is an intro into the technology. So POROS is based on a 50 micron polymeric bead that's manufactured from polystyrene diamine benzene. It is a comparable small bead with the 50 micron bead size that offers a very good resolution given the high flow rates that are necessary, that are enabled by the large through bores that are displayed in the middle section of this slide. You see an electron micrograph of the surface morphology of this bead, and you see immediately these large through pores that allow to have a facilitated transport into the particle and reduce the mass transfer limitation. This allows to have a capacity and also resolution that is very well maintained over wider ranges of flow. And on the right-hand side, you see the pressure flow rate relationship that is very linear for porous resins as compared to softer resins, which tend to compress and then show a higher back pressure at higher flow rates. This slide summarizes the experiments that were performed and are shown on the next slides. We used the CaptureSelect eluates that were pooled and concentrated, buffer exchanged, and basically prepared for the polish operations on POROS HQ, which is an anion exchange resin. In the middle section, you see a table with the summary of the different conditions that were tested. We tested 400 milligrams per milliliter resin mass loading of IgG, as well as 600 milligrams. And we tested a pH range that went from 5 to 6.0. The right-hand side, you see the analysis that was done: IgG, purity, IgG subclass distribution, and the impurity profile that was also shown or discussed in the earlier slides in the affinity section. On this slide, I would like to show the findings that we had. During loading of the anion exchanger, we found that the subclass distribution changed based on the amount of mass that was loaded on this adsorbent. Here you see on the left-hand side a chart that summarizes the subclass distribution. At the very bottom, you see HQ load. This is the sample that was used for the further polish. And going up through the different samples until you reach the HQ flow-through pool, you will notice that the subclass distribution changes. In the first phase of the loading, FT1, you see the IgG subclass 4 is retained on the resin and therefore is lower represented in the flow-through. In the duration of the loading, in the other three loading phases, you see IgG4 is increasing until IgG4 is actually higher than the input material's IgG4 content. So this indicates that during the phase of loading, the IgGs that are partially bound by the resin are displaced by stronger binding impurities. Finally, after having loaded 600 milligrams of IgG containing material, you will see that the subclass distribution is actually very much comparable with the input material. And this is displayed on the left-hand side of this slide. Now I would like to discuss a bit how we optimized the IgG4 content in the flow-through. Here you see a graph that displays IgG4 as a percentage of the totally available IgG4 that was loaded via the feed material. And you see 65% in the left-hand side of this graph at pH 6, loadings of 400 and 600 milligrams resulted in a IgG4 percentage conversion into the flow-through of only 65 to 76%. So we decided to lower the pH, pH to pH 5.5 or 5.2, and finally to 5.0, which allowed to increase the IgG4 conversion into the flow-through and increase the percentage of IgG4 that is found in the flow-through. We evaluated the IgG yield and the impurity implications of those conditions, and based on the IgG yield, we see there is no impact of varying the pH and the loading. We find high IgG yield under any condition that was tested in the high 90%. On the right-hand side, you see IgG and IgM depletion performance as a function of different conditions. And here you see there is a slight impact on IgA with lowering the pH down to pH 5. As expected, there is lower capacity for IgA on the adsorbent, and therefore slightly higher impurity of IgA can be found or could be found in the flow-through. On the other side, for IgM, there is no impact over the entire range of tested conditions. Now, considering the input materials already very high purity, even 84% depletion efficiency at pH 5 that was found for IgA, which would be an issue normally in a classical IVIG process, is not the process in this case, because, as I said, the input material is already at a very high purity. So 80% depletion is sufficient to polish the material to acceptable ranges for this impurity. Again, on this slide, we are again evaluating purity based on STS page and size exclusion chromatography. On the left-hand side, the STS page, we see very pure material. There is almost just one or two bands visible for IgG. And on the right-hand side, we see there is almost only monomeric IgG, except for the cases of 600 milligrams loading, where we found minor amounts of aggregate traces, where we could conclude there is some minor amount of aggregation in the material. So concluding, this study showed that we were able to optimize the process towards the retention of the subclass distribution. Subclass distribution after anion exchange very much complies with the plasma-like subclass distribution. We could do this by optimizing the pH and the loadings, and we have still a very good clearance of impurities. So IgG yield and purity is very high and is very robust, because over a wide range of tested conditions, it shows a high IgG yield. Now I would like to talk about a few more options that are available to utilize the input plasma material to its maximum. So this is an overview on which affinity products are available for the different plasma relevant targets at the moment. We see at the right-hand section of this table, in the bioprocess products section, there are already a couple of slides, a couple of resins available for the different targets. On the next section, further left, we see research use only products. These targets are ready developed, are scalable, but are lacking still the documentation that is needed for being used as a bioprocess product. Documentation like regulatory support file, validation, upscale batches, all these missing points can be targeted and can be solved anytime, and these products can be progressed further to a bioprocess product anytime. Further to the left, the further we go to the left, the earlier in the development process a product is found. We have available a couple of lead resins. We have prototype resins where the solid support and the ligand density is not yet fixed. We have also a product in ligand screening. And at the very left side, we have always the plasma library, which is a very broad library that can be used to generate any product anytime. And with that, I would like to thank you for your attention.